My name is Dr. Revathi Raj. I'm a pediatric hematologist. We deal with blood related problems, and today I'm going to talk about sickle cell anemia. So, it's one of those disorders which we call orphan diseases. People hear about it, they know about it, but awareness is still lacking in our country. And on this World Sickle Day, it is important to remember the tens of thousands of patients in our country who are suffering from sickle cell disease, which is a completely preventable disorder. So, what you're about to see now, and this information and this awareness created today, could prevent a new birth of sickle cell anemia and would help our next generation. So, sickle cell anemia is a blood disorder, it is genetic, and in our country, peculiarly, it affects tribal population, which is why these are people who are very simple people, they don't make a noise, but they have a everyday struggle with pain. And sickle cell anemia has started in our country in tribal districts in Gujarat, Madhya Pradesh, and Orissa, and in Tamil Nadu we have a small pocket in the Nilgiri Toda area. So these are genetic disorders which affect the red blood cells. By changing the shape of red blood cells, these tribal population get natural protection against malaria. So these are called sickle cell carriers. So they don't have any problems, but they have natural protection against malaria by making a small change in the hemoglobin. But if both the partners, the mother and father, are carriers of sickle cell anemia, a baby can be born with both the sickle genes, and this is called sickle cell disease. The shape of the red blood cells are like a sickle shape, like a knife, and because it's sickle shape, it doesn't smoothly go through the blood pipes. So red blood cells have to live in our body for 120 days, carrying oxygen, giving it to different parts of the body. But the sickle shape makes them break down easily, and because of the sickle shape, the circulation in very small blood pipes get jammed very frequently. So these children suffer in pain. So we see often 3-month-old babies who have hand swelling. They are irritable, they're crying. As they grow older, they have back pain, they have leg pain. They cannot tolerate changes in the weather. When it's too hot or too cold, there is more sickling and they are prone to infections very frequently. So there is lifelong suffering from sickle cell anemia. And we find from these patients, as we follow up, by the time they are in their 30s, a lot of them have hip problems. The hip joint gets affected, and the most fatal thing that can happen is kidney problem or strokes or chest crisis. So these are conditions we can prevent by doing simple blood test by awareness. A test called HB electrophoresis can be done during early pregnancy. If the mother is a carrier, we test the partner. If both are carriers, then we can test the baby at 11 weeks of pregnancy to see if the baby is affected or not, and we can prevent future births, especially in these high risk endemic areas. So, for example, we did a survey in Chitteri in Dharmapuri district, and we found that more than 10% of the population were sickle carriers, and they thought there was just problem with the water supply. That's why the children are getting sick. So awareness can help everyone. The only curative option for sickle cell anemia is a bone marrow transplantation. Gene therapy is coming, but it's not yet arrived in our country. For doing the curative bone marrow transplantation, the patient needs a donor. Only 30% of the patients have a matched family donor. The rest 70% who could benefit from the transplant and can change the blood don't have a donor. This is where registering today as an unrelated donor can help save a life of a person with any fatal blood disorder. It can be sickle cell anemia, it can be thalassemia, it can be leukemia or blood cancer. All these conditions can be cured by doing bone marrow transplantation, and the person who registers as a volunteer donor to donate stem cells, there is no impact to them, they don't lose anything, and by that donation they can save a life. So this is an appeal today to Raise awareness about sickle, talk to your friends, talk to your family, and make sure we can prevent both sickle cell anemia and thalassemia in our country by testing all pregnant women, and also register as a blood donor to save patients with blood disorders, and as a stem cell donor so that we can give the gift of life today. Thank you.